If you don't like insurance, don't buy insurance to make decisions on your behalf. Keep all your money, be self-pay. It's pretty simple, and you get a discount. Kathleen, I am not sure what fantasy land you are living in that caused you to leave this comment on my video about Brianna Boston. You know, the mother of three who was on the phone with her health insurance provider, Blue Cross and Blue Shield, frustrated, exasperated, pushed beyond her limits as they denied her care that she was paying to receive, coverage that she paid premiums for. She lost her temper and said something she didn't mean, and the for-profit healthcare industry has decided to make an example out of her, arresting her and charging her with a crime that could land her in prison for 15 years. On that video, you left this comment. Okay, so first off, we have this thing called the Affordable Care Act. You're required to carry coverage for you and your children. You have to provide proof of that on your taxes. Now, I self-insure for lots of things. I pay into a kitty for car repairs, for my dog's vet bills. I create little emergency funds for each of those things. But that takes a level of financial privilege and stability that we didn't have for many years, and most Americans don't have. But there are none of us except the super, super wealthy who can afford to self-insure against healthcare costs for us and our children. For example, when I broke my right leg, I had to have emergency surgery and then had complications that resulted in a 5-day hospital stay. The bill for that portion of my care alone was $71,000. I then needed 2 subsequent surgeries, many follow-up appointments with orthopedics, and a run of physical therapy. I could not possibly have self-insured for the hundreds of thousands of dollars of care that I needed. Not to mention, there is no orthopod anywhere who would have taken me as a patient without health coverage. I've watched fellow Derby friends with serious injuries who didn't have health insurance just not get treatment. Probably tore your ACL, no health coverage. Okay, well, we're not ordering an MRI for you because you obviously can't pay for it. You can still walk with no ACL, just wear a brace because no orthopod is going to touch you. Let me give you another example. My mother had cancer. Without healthcare coverage, her medical bills exceeded $1.5 million. Do you have $1.5 million to be self-pay? Also, when you say you get a discount, no, you don't. That's one of the problems with health insurance in America. Health care in America, is that we need our insurers to have the negotiated rate with hospitals and providers. If you have no insurance, the amount that your provider charges you is astronomically more on average. You may have noticed, right? Like the anesthesiologist submits their bill for $7,600. But then your explanation of benefits, your EOB from your insurance company, will tell you the contracted rate that they pay out to that anesthesiologist, and it's like $1,500. And your anesthesiologist has a contract with your health insurance provider to accept that as payment in full. They don't have a contract with you to accept a reduced rate as payment in full. Paying premiums into a health insurance plan, no matter how crappy, gives you access to these giant corporations' negotiated rates. The whole system is needlessly complex and needlessly rigged. Rigged from every side because we are in a for-profit system. I mean, most of us are. Again, I have nonprofit healthcare through Kaiser, like a lot of folks on the West Coast. My providers are for profit, the hospitals are for profit, but my insurance plan is not for profit. But the majority of Americans have for-profit healthcare. And that means every step of the way, those hospitals, those health insurance providers, their obligation is to their bosses and to the shareholders. Their priority is profit, not providing care. So they are looking for opportunities to maximize their profit margin every step of the way. It's not about providing care for the American people. It's not about affordability. It's not about physicians being able to give the kind of care and treat their patients in a way that they feel is medically appropriate. It's not about folks getting their physical and mental health care needs met. It's not about the sustainability of the system. It is, how do we maximize profit for the shareholders in this quarter? How do we maintain our profit projections and pay out the biggest dividends at the end of the day? And when you realize that a lot of those shareholders, the ones with loads and loads of stock, are also the CEOs and the ones making the decisions about who gets care and who doesn't, where corners are cut and where they're not, where denials happen and where approvals happen, it all starts to make a lot more sense. This comment is just, I don't know if you truly believe this. Like, do you really believe what you said here? I don't know, but it's important to remember that we are all temporarily able-bodied. Everyone has the potential for injuries and illness, disability, health crises that you cannot predict for, and in this current system, you cannot possibly save for. This is terrible, terrible advice, and I hope nobody will take it. And I hope that you never come to experience the consequences, financial and lack of care consequences that come with taking up this foolish position.